Hello, good morning. This is MJ Wesley, founder from Pacesdiaries, and today we are going to see the neurological examination. A lot of people ask me to post a video on how to do a proper neurological examination, which we are going to see today. It's very important. All right, so don't get scared of neurology. It's all mathematics. If you know how to approach a case, and it's done. Your diagnosis, you will get it in a minute or two. It's not confusing, it's simple. Just approach it carefully. All right, when it comes to neurological examination, there are ifs, ands, and buts. I'm going to tell you. You should be very thorough with what equipments you need to carry and how to approach an examination. Here we are going to see the examination of an upper limb. There can be any command. All right, it can be like examine the gentleman's upper limb, or they will tell a 28-year-old man came with weakness in his upper limbs. Would you like to examine his upper limbs? All right. So how are you going to approach an examination of an upper limb in a neurological station, especially station 3? Okay, you're going to come, and as soon as you come, okay, you can find the sanitizer. Kindly use the sanitizer in your hand. Turn to the examiners first and greet them. Good morning, sir. Good morning, ma'am. And then go ahead, see the patient and greet him. Hello, sir. Good morning. My name is Wesley. I am one of the PACES candidates here, and I'm going to examine you. Is it all right with you? Then tell at any point of time, if he has any pain, he can let me know. Just tell what you're going to do. Then look around the bedside. Here, nothing is there. You may find a wheelchair. You may find a crutch. You may find a walking stick by the bedside. Calibration starts there. You may find a modified footwear. Calibration starts there. So as soon as you find these things, you have to register what you're finding. Then generally look at the patient. Is he having any phases? Is he having maybe like some ptosis, facial asymmetry, any gross wasting, or is he having abnormal movements? We have cases of chorea that has come in PACES examination. Then look around for scars. See the head. Any craniotomy scars are there anywhere? And sometimes the CP angle approach, you will find scar here deeply running. Okay, this gentleman doesn't have that much of hair. His hair is neatly trimmed. But there are people with big hairs. That time you have to just expose and see nice and gentle. Then see for scars in the cervical region, scars in the lumbar region. Once you have done with that, you are going to just look at the limbs. You are going to do something called MINDS protocol, which we have explained in our website. First is muscle wasting. Look for muscle wasting. Is it proximal wasting is there? Any distal muscle wasting is there? In MND, you can have that, motor neuron disease, or you can have distal wasting in CAT1 lesion. All right, then muscle wasting, then involuntary movement, a choreothetoid movement, or you see having any symmetrical tremor, okay, supination, pronation tremor of Parkinson's disease, or any other abnormal movement is there. All right, and also you need to elicit fasciculation. How to do that? Use 3 fingers, gently tap with the bulk of the muscle, a gentle tap. If there is any fasciculation, you will find. And N, look for any neurocutaneous markers. And D, look for any deformities. Could be an aphthous deformity, could be a claw hand, it can be partial or a complete clawing of the hand, could be a wrist drop. You have to see. Once you have done, S for scars. I have seen scars in the head, cervical and lumbar region, also scar in the extensor surfaces. All right, any orthopedic scars, any traumatic scars you are finding, look for scars. Once you have done that, then the next thing you are going to do is remember this TPRCS, that is tone, power, reflex, coordination and sensation. Always make sure, one more thing I forgot to tell you, there is a pillow. Whenever you are going to examine hands, it doesn't matter, neurology or rheumatology, there should be a pillow there. So first thing, tone. Tone is examine across the joint. At the level of wrist, just go gently, shake his hand, just flip the wrist, and at the level of elbow. That's your tone. Don't do it so slowly. Just extend his elbow faster. You can find if there is any spasticity. All right, see, same way, likewise, I'm just going to examine your tone, sir. Keep your hands nice and relaxed and check for tone. All right, please don't go around grinding shoulders or doing any abnormal maneuvers which is not indicated. Then coming to power, I'm going to tell you exactly what Academy of Medical Royal Colleges decided and wanted you to check. All right, just first at the level of shoulder joint, ask him to keep the hands like this and ask him to push it up and push it down. That's it. Then at the level of the elbow, we are going to check flexion and extension, stabilize the joint. Push it towards you, sir. Push it towards you. Push it away. That's it. Thank you so much. At the level of elbow, push it towards you. Push it away. Thank you so much. Then at the level of the wrist, ask him to close the wrist tight and ask him to push it up, and push it down. All right, then again, ask him to push it up, and push it down. Wrist, flexion and extension. Then at the level of fingers, extension, push it up, sir. Fingers extension, push it up. Then finger abduction, push it up, push it out. Then again finger abduction, push it out, push it out. Then thumb abduction, push it up, and then finger grip. Closely catch my fingers, tight, don't let me push it out. That's it. Beyond this, you are not expected to do anything. All right, if there is a radial nerve palsy or an ulnar nerve palsy, it's a different case. I will tell you with a real patient what to do with that. All right, then tone is done, power is done, then comes the reflex. We suggest you to use this knee hammer. It's a very good one. It's an MDF knee hammer. You can get it over Amazon across the world. All right, so reflex, what we are going to do is we are going to check 3 reflexes for upper limb: biceps, triceps and supinator. These are called muscle stretch reflexes. So you have to stretch it properly, then only you will get the reflex. If you don't stretch the muscle, no reflex is going to come for you. All right, just stretch it nice and gentle. That's it. Same way on the opposite side, stretch it nice and gentle. That's it. Then at the level of triceps, see here, just directly tap it at the level of triceps. That's it. Same here, compare the reflexes at the level of triceps, nice and gentle. Then again supinator, keep your 2 fingers, gentle tap. Supinator, keep your 2 fingers, gentle tap. That's it. Once you have done the reflexes, tone is done, power is done, reflex is done, then coordination. Coordination is straightforward. Just give a command, ask him to take his index finger, touch the tip of the nose and touch your fingers. Make sure he can fully extend his hand once he is doing. Can you do that, sir, for me, please? Thank you. Thank you. Thank you so much. Can you do it with other hands, please? Thank you. Thank you. Thank you so much, sir. Thank you. Can keep his hands down. Then again you can check dysdiadochokinesia. You can tell, sir, just take your hand and tap your hand alternatively like this, tap the other hand. Yeah, keep your hands nice and relaxed. Yeah, and do it, please. Yeah. Faster. Yeah, this hand. He can do it. All right. Once it is done, then comes sensation. This is the tricky part. Many people don't know. That's why we have drawn the dermatomes for you. This is the C4 dermatome. If you can see on both sides, C4, this is C5 dermatome. All right, on both sides, this is your T2, this is your C6, this is your T1 on both sides. See here once again, C4, T2, and this is C6, C5, C6, T1, here C8, C7. The tip of the thumb is C6, tip of the middle finger is C7, tip of the little finger is C8, and higher up the axilla is T2, and here is your T1. All right. Now there are 2 modalities of sensation. First is an anterolateral column, then comes your dorsal column. Both the modalities of sensation has to be examined. So what we are going to do first? First is the fine touch. You can take a whisper for cotton and you can ask him to close his eyes and just touch gently and tell. Can you feel it, sir? I'm going to touch your hands with this and I want you to tell me whether you feel, number one, and whether you feel the same on both sides. All right. So now I'm going to just touch at the C4. Can you feel it, sir?
Yes, sir.
Can you feel it, sir?
Yes, sir.
Both sides you can feel. Next, coming to C5. Can you feel it, sir?
Yes, sir.
Can you feel it, sir?
Yes, sir.
Nice. Then coming to C6, you can directly go to the thumb. Can you feel it, sir?
Yes, sir.
C6. Can you feel it, sir?
Yes, sir.
Fantastic. Then coming to C7, tip of the middle finger. Can you feel it, sir?
Yes, sir.
Can you feel it?
Yes, sir.
Perfect. Can you feel it, sir?
Yes, sir.
C8. Can you feel it?
Yes, sir.
T1. Can you feel it,
Yes.
sir?
Yes, sir.
Can you feel it?
Yes, sir.
You don't need to do T2. Suppose if he is having a loss of sensation, you have to ascend up and find up to level of which dermatome he has lost the sensation. Can you see this? You shouldn't forget it. Okay. Next, coming to the pinprick sensation. This is done with a neurotip. Take a careful look at that. This is neurotip. It's not going to hurt the patient. Same thing. With his eyes closed, just touch and tell. Can you feel it?
Yes, sir.
I'm just going to touch. Same way I want you to tell me whether you can feel and feel the same. All right. C4. Can you feel it, sir?
Yes, sir.
C4. Can you feel it, sir?
Yes, sir.
And C5. Can you feel it, sir?
Yes, sir.
C5. Can you feel it, sir?
Yes, sir.
C6. Can you feel it, sir?
Yes, sir.
C6. Can you feel it, sir?
Yes, sir.
C7. Can you feel it, sir?
Yes, sir.
C7. Can you feel it, sir?
Yes, sir.
C8. Can you feel it, sir?
Yes, sir.
C8. Can you feel it, sir?
Yes, sir.
T1. Can you feel it?
Yes, sir.
T1. Can you feel it?
Yes, sir.
Thank you so much. You can open your eyes, sir. Now comes, all right. Now comes the dorsal column sensation. There are two: vibration, proprioception. We are going to get it done now, and people have trouble identifying the tuning forks. Sometimes in some centers they will keep 128 and they'll keep 512, and sometimes a 256 will also be there. For a vibration, you are going to use the longer one, that is 128. There was a time a candidate was too confused which one to pick. He was wriggling, he was fumbling, he was just walking around. The patient took and gave. Examine me with this. It shouldn't happen. The longest tuning fork is the one which we are going to use for the vibration sense. If you see here, yeah, that's 128. All right? Okay. So what you're going to do, there are a couple of things candidates do. Please don't do that. That will look utterly unprofessional. You know, using the tuning fork to make it vibrate, people hit the tip of the cot or edge of the cot like this. Please don't make such noise. It will look absolutely odd. And some people will try to do like this, you know, they'll take the knee hammer and strike like this before examiner. Hey, come on, you're not going to do any dance with the examiner or with the patient. Don't do that. Take the tuning fork, nice and gentle, use your thenar eminence or hypothenar eminence. A gentle strike. See here, gentle strike. If you're strong enough, it's more than enough. All right, a gentle strike, and ask him to close the eyes and ask, can you feel it, sir?
Yes, sir.
Now it stopped?
Yes.
That's it. Go to the tip of the finger. Just ask, can you feel it?
Yes, sir.
Now stop. Same tip of the finger.
Yes, sir.
Can you feel it? Now stop. Done. All right. Some people would love to keep in a bony prominence. No problem. If the vibration is lost, then go to the next adjacent joint. Maybe in the finger if it is lost, go to the wrist, go to the elbow, shoulder joints and above. All right. Now comes the last sensation we are going to check is the proprioception. You can ask him to open the eyes. Can you open the eyes, sir? If you carefully see, sir, this is down, this is up. I'm going to ask you to close your eyes and I'm going to move the fingers up and down. I want you to tell me. All right, please hold it gentle and don't hold like this. Hold to the sides and don't move beyond 30 degrees. Like some candidates move like this, like that and all. Don't move. Just stabilize it, and with his eyes closed, just ask him, is it down or up, sir?
Down.
Now?
Up.
That's it, done. Now can you tell me, is it down or up?
Down.
Now?
Up.
That's all. Your neurological examination of the upper limb is over. If you practice well enough, it's not going to take more than 4.5 to 5 minutes, including the patients with findings. You have to practice, practice, practice. All right? If you have any issues or doubts with the PACES examination, you are more than welcome to ask our team members. We are dedicated to help you and help you enrich your clinical examination skills, not just for PACES, but for any examination and for your real life clinical practice. Thank you so much.